Okay, in atrial septal defect, again it's a left to right shunt, so you will have right atrial enlargement, right ventricular enlargement, all that will be present here. And there are three types: fossa ovalis, ostium secundum, ostium primum. Fossa ovalis is a normal septal defect which is physiological and will flow spontaneously. Ostium secundum is the most common and also pathological and will be central between the two atriums. Ostium primum is in the lower interatrial septal defect and it is associated with mitral regurgitation. Now, sinus venosus is present at the interatrial septum associated with partial anomalous pulmonary venosus. Now, if you see the sounds, heart sounds, S1 will be normal, apex also will be normal, S2 is wide and fixed, because the thing in ASD is that it is pathological and it will persist for a longer time, so it will be wide and fixed. Whereas in case of VSD, since it's developing, it will be wide and variable split. S3 again you will see, because of CHF will present between 6 to 10 weeks, and there's no shunt murmur as in VSD, and again there's no thrill, but you'll have the flow murmur. Ejection systolic murmur will be present at the pulmonary area, and you have a diastolic murmur, but this time it will be present in the tricuspid area. So if you have right atrial enlargement with respect to ostium secundum, you will have respective ECG changes, like you will have a 2 R waves pattern in V1, RSR pattern, that is what you will see. Whereas in ostium primum with associated NMR, you'll have left atrial enlargement. X-ray again, you have cardiomegaly, pulmonary pithora, and all that. So yeah, they will be asymptomatic. On a long term, they'll develop the right atrial hypertrophy, atrium stretch, atrial tachycardia. So complications will be like tachycardia, stroke, arrhythmia, pulmonary hypertension, Eisenmenger syndrome, which will develop around 40 years. And you will not have infective endocarditis here, only in VSD. And surgery, if you see at 4 years, it indicates medical treatment daily. If the medical treatment fails, you can do surgery, and it's a catheter based procedure. You will do Dacron patch and umbrella closure. What are the contraindications for surgical thing is that if you have pulmonary hypertension, if it's a small defect, it's a trivial shunt, you don't need to do surgery immediately. You do only when it's a quite big septal defect.